Thanks a lot for staying with us. I'm Shivani Gupta. Let's take a quick check of how the situation is in at least two of the metros in India that are facing an onslaught of rising active cases. Even as cases are stabilizing in Delhi and Mumbai that were garnering all the headlines over the last few weeks, now the focus is on cities like Bengaluru and Chennai, which are witnessing the peaks now. The active caseloads are increasing and pressure on the health infrastructure is also increasing, especially as the metros cater to many patients coming from nearby areas too. Let's first take a look at Bengaluru, for example. Over the last 1 week or so, the new daily cases, the rise in the new daily cases that are being reported has come down over a period of week, but it is still fairly high, making it one of the worst affected cities in the country currently. The bigger worry for the city of Bengaluru, though, is the active caseload, which is standing at a whopping 3.6 lakh cases currently. These are the numbers, of course, that continue to be extremely problematic for the city of Bengaluru. Let's play the numbers for the active cases currently, caseload as well. And there you would see that the cases are actually at 3.6 lakh currently. It has gone up and down a little bit, but it is continuing to be extremely alarming as far as Bengaluru is concerned. We'll play those numbers in just a bit. Daily new cases have been rising consistently for Chennai as well. It has reached the mark of about 7,500 plus cases now. You see the graph there, the graph is obviously only rising, and the city is preparing hard to meet what would be the peak of this wave, even though it has faced similar peaks in the past. Active caseload, when we talk about Chennai, that is also rising from 33,000 a week ago to about 40,000 this week. So that's the graph that Chennai is also looking at very worryingly. Remember, both the states of Karnataka and Tamil Nadu have gone for strict lockdowns because that was being seen as the only way perhaps that can deal with the situation. So the question that we're asking today with our experts is that even as the focus shifts away from Delhi and Mumbai, how well prepared are the cities of Chennai and Bengaluru? All right, let me go across and introduce our guests that are joining us right now. First up, we are joined by Dr. J. Radhakrishnan, Principal Secretary, Health and Family Welfare, Tamil Nadu. Also, Girdhar R. Babu, Head, Life Course Epidemiology, and also the Karnataka COVID Task Force member. Also joining us on the show, Dr. Vishal Rao, also part of the COVID task force of the government of Karnataka. Dr. Anusha Rohit is also joining us, senior consultant and head of microbiology and chair of infection control at Madras Medical Mission. Dr. Ram Narasimhan, senior consultant internal medicine, is also joining us on the show. First, let me go across to the health secretary joining us from Tamil Nadu. Thanks a lot for joining us. I just wanted to begin by asking you, how do you view the situation in Chennai currently? How would you describe the situation? Because the total number of cases are rising, the caseload is rising, and of course the daily new cases are rising.
See, it's actually, if you see, from 10th May onwards till 24th May, we have put this very strict guidelines after the new government took over. Lockdown was issued, and even with regard to office, the movements have come down. So our reading has been, within discussion with the public health experts, if you look at the growth, if you look at Chennai also, my understanding is today it will be slightly lesser than yesterday, but that growth which was happening, from it started at very low, almost 200 in February to almost 700, 1,500 yesterday. So that in the last 2-3 days we see a distinct slowing down. But having said that, in COVID, one lesson, because in the last I was there, and in fact I was coordinating Chennai that initially before my health secretary, there is shortcut to hard work of content. So the biggest challenge during second wave has been, focus has been on vaccination, which will help in medium term and long term. There was a lack of cooperation from public with regard to containment areas, mini containment areas. Probably if we had, followed that in a very classical manner, we would not have the necessity of going to lockdown kind of situation. So, but now we have got a commissioner and a new commissioner and 15 field support teams assisting him and a nodal officer. So we are doing that classical field camps. Then the earlier thing, during the election period, we could not do the house to house follow-up. That has been started. Then involving non-governmental organization. So we have gone back to the basics. And I feel that this classical work is only, and the aggressive testing. The last time the maximum amount tested was 13,000 RT-PCR. Today, for the last 4-5 days, we have crossed 30,000 tests in Chennai, RT-PCR. Unlike other places, we do RT-PCR tests. So we are keeping our fingers crossed, but we need large-scale public cooperation, because this time around, there was a lot of within community spread and within house spread, and a lot of lack of adherence for COVID appropriate behavior, not necessarily not wearing mask in public areas, but even within home quarantine. People took it casually. Unlike last time, once you are a COVID positive, people used to keep in the house, stay separately and all.
Right. I find it very interesting that you're saying that instead of harping for vaccination, which is a midterm solution, the focus should still continue to be on testing, tracking, containment, and as you said, COVID appropriate behavior. You talk to other states, everybody's only clamoring for vaccination. But the message that you're sending is that actually the basics are still the same as they were last year. But Chennai Corporation, for example, is hiring MBBS students to augment the workforce. That continues to be a big challenge, because for over 1.5 years now, the health force has been working and they've been working non-stop. So these students would be used for teleconsultation that you'll be launching, for example. There are also war rooms that have been set up in all zones. Several of these measures that you've taken, do you think this will help you avoid a very bad situation, for example, what transpired in Delhi a few weeks ago?
See, I've been through a number of disasters, whether it was tsunami or thing. One is we should definitely not compare each other. All states are struggling and all states are taking their best efforts. In Chennai, for having said that, with regard to the new government has also permitted us to recruit 2,000 more doctors, 6,000 more nurses, 2,000 paramedical staff, and that flexibility with the new government policy of either elderly retired people willing, because elderly people will be comorbid, and youngsters who are willing. So that flexibility, similarly Ayush doctors. So that flexibility we have given in a decentralized approach. Whoever is willing, we should utilize. The thing is that the people in the hospital are getting exhausted because the cases are more. So the more number of personnel whom we bring in, it will definitely help in improving the care, particularly people willing to stay in COVID care centers would improve. And similarly, the fever camps can be handled. Basically, it is much more mechanical, looking at a pulse oximeter, looking at initial signs of this thing. In fact, we are even going to the next extent of, using a health inspector house to house to identify the symptom, and using telemedicine kind of thing, and showing the reports and saying who needs to come out. In fact, I greatly appreciate the Kerala model, where the hospitalization is, compared to other states, far lesser, and the mortality is also lesser. So we all need to learn from each other, and I'm pretty sure that as the personnel who are very tired get more replacements, it will definitely improve. But we really need to ramp up. This is maybe the second wave. The pointer or lessons from this is that people observe, including administration, everybody thinking that things have come down, whatever we had improved was sufficient. That lesson is something which we need to learn if we need to manage the upcoming newer things. I'm sure every lesson, nobody wants to do it deliberately all over the world.
Let me bring in Dr. Vishal Rao also at this stage. Speaking of Bengaluru, the situation, of course, in Bengaluru is extremely serious. If you could go to Dr. Vishal Rao, where do you think Bengaluru is focusing its fight on today? What is working for Bengaluru? What is not working for Bengaluru?
Good evening, Shivani. I think if you look at the current numbers that are in Bangalore today or in Karnataka, the state currently has still recorded, as of yesterday, about 40,000 new cases, 500 deaths, and the positivity rate is around 30%. Now, with these figures, I think what is very concerning for the state would be that if everyday positivity rate is continuing still, I mean, at the peak when we, just before the lockdown, we were at about 50,000 cases. It has now dropped down to about 40,000 cases, which is still a very, very concerning number. And we are hoping with the lockdown continuing, we are going to have a dip in this number. But yet, what we see is that I think as an overall strategy, whether it is Karnataka or any other state, we need to know that hospitals, beds ventilators or oxygen have been geared up for a small set of population. It is not being geared up for a full population. As of today, our hospitals are filled with not only with COVID, now with mucar and other complications which are related to COVID. And this is leading to a very major neglect for non-communicable diseases like cardiac diseases, renal diseases, hypertension, cancer. So many other diseases are getting neglected.
Okay.
So what we are overall seeing today is a larger conundrum of multiple factors playing. And I would like to sum it up with one point, that today, let's assume that Karnataka has 1,20,000 beds totally, of which half of them, about 50 to 60,000, have oxygenation, and they are ramping it up for increasing the oxygenation bed at a rate of 50,000 cases per day. 17% of them requiring oxygen. It means about 8,500 cases per day who need oxygen. It is not enough, because within 2 weeks you will reach the number of 1,25,000, which will fill up the beds. So it's not going to be an easy task for us at healthcare systems to try and say that we will manage beds by doing lockdown. So what I want to reiterate is, the final solution is that if we lock down, it's a time to prepare. What do you prepare for? Beds? No, there are limited number of beds. Oxygen, again in shortage. Ventilator beds, we have around 4 to 5,000 ventilator beds in Karnataka. So it's not that you can ramp up these numbers by doing a lockdown. I think the major key driving is people's behavior towards stopping the virus, and I've been reiterating it, that this virus does not have hands and legs. We are the ones moving this virus, and the only two weapons for this are going to be our mask and vaccine.
Right.
So I think all emphasis is right now on the vaccine, because unless we vaccinate the population, we are not going to be able to achieve what we are talking about, the herd immunity.
Yeah.
And I
There
would
is,
like to
I'll
close
come
with-
back to you on herd immunity. There are some concerns being raised that there is so much mutation happening that 6 months, 8 months down the line, there would be no herd immunity. But doctor, I'll come back to you. Let me go across to Dr. Girdhar also. One of the things that both Chennai and Bengaluru are doing, for example, and we're looking to see what is working for them, what is not working for them, are the triage facilities. There are large triage facilities that have been set up in both Bengaluru and Chennai. And they seem to be really helping in getting patients the help they need quickly, also lowering the burden on hospitals by avoiding the unnecessary rush, because what is happening and what has been witnessed in other metros, for example, Delhi in the past, is that, people don't always know where to go. So they rush to the nearest hospital. They don't always get what they need. They want a bed there, and they're either waiting there, they're struggling, they couldn't get it through teleconsultation, etc. So could you tell us more about these triage facilities and how they're helping you?
So what a triage facility does is it identifies those who deserve to be treated, and then it sort of prioritizes who has to be treated on a priority compared to who else can be, taking care of a supportive therapy role. So all those people who have mild and moderate respiratory distress, they need not go to an ICU facility. They can go to an oxygenated bed. And if there are oxygen concentrators available at a lower level of hospital or a health center, they can use it. And if people don't have respiratory distress, they can get some home isolation kits, some kind of counseling from the center, and then they go back home, and then somebody can monitor them. And there is a wonderful tele support system which is being set up by the Rajiv Gandhi University of Health Sciences, where final year medical students and also postgraduates are trying to counsel the people who are in home isolation. And along with the home isolation kits, one can send oxygen concentrators. In terms of pulse oximeters, and people can monitor, and the doctors can ask them at least twice or thrice a day in terms of what the oxygen saturation levels are. And if it is dropping, then can immediately be referred to facilities where oxygen is available.
Right.
What Triad Center does is it reduces the load on tertiary hospital. It reduces the agony and suffering for people having to go from one hospital to another. And then there is a coordinated care mechanism. Because there is triage facility, then there is a links to the hospitals in the ward. So that's efficient entry into a hospital. At the same time, we also have to ensure efficient exit, which means people who recover should be discharged from the hospital to step down facilities. So this approach is called the Bangalore Decentralization Committee, headed by the Revenue Secretary, as 3E model: efficient entry, efficient exit, which means discharge on time, and then making sure that the bed turnover is very efficient. And the third is empowering the hospitals, which means everybody is burdening the hospitals. Instead of that, can the ward committees stand with the hospitals and ask them what help do they need? Do they need oxygen? Do they need some supplies? Can they help in any way the hospitals? By this mechanism, and if it really gets strengthened in the long term, I hope this can be a good model. Last thing on this, these are not transient or temporary mechanisms. Ward committees are permanent mechanisms, and these are notified by the disaster management committee as a sort of measure to tackle any disaster in future.
I want to quickly go across to the Tamil Nadu Health Secretary also, who's continuing to be with us. I want to ask you also about these triage centers. There are several of these centers that are working in all zones in Chennai. In fact, a very big center has also been opened in Chennai just recently. How are they helping you? Because this is something we did not see in some other cities. And how do you plan to expand them over the next few days?
See, the triage center concept came during the last wave. That time it was 10. This time it is 17, and we are planning to increase it to at least 40 or 50, at least 5 centers per zone. So 75, at least 75. The biggest advantage is that people rushing to the hospital. This time around, the level of last time around stigma was there more, so they were likely to go decentralized. This time around, people initially they are ignoring it, but when they are getting the breathlessness, they are rushing to the hospital. So the triage center really helps us in breaking this crowd. Those who need to just be at home in case they have a single room and a individual toilet facility which is certified by the thing. Second is that the basic blood parameter and X-ray without the complicated CT scan and the delays, they are able to assess that whether he is actually he or she is in a very risky category, or he is still having very minor kind of thing, so he can be managed. Then they get followed up. Second is people who can go to health center, which is neither a COVID hospital nor a thing, but has facilities of oxygen and all. And third is somebody who has really low oxygenation level, those kind of category even without checking. And those during checking, they find that the lung involvement is fairly substantive, they get shifted immediately to the hospital. So the hospital management improves. There is still a long way to go, but unlike last time 10, it is already 17. But yesterday our new health minister directed that it should be at least 5 per zone. We have 15 zones, so it will be around 75. This will greatly reduce the pressure on the COVID hospitals.
Interesting. And this is perhaps something that can be looked at all other large cities, even smaller towns, because what this center does, a triage center does, is that there is some point to go for anybody who's experiencing any symptom and get some help immediately, and then the doctors there and the caretakers there can assess whether this person needs a bed or this person can be handled at home. So it just reduces, as all of our guests were mentioning, the load on the hospitals because of the rush that continues to happen. Let me bring in Dr. Rama Narasimhan also. What do you think would be the biggest challenge for Chennai in the days to come? Because it has seen very bad number of cases in the past too, in 2022. What are the lessons that have been learned? Are there issues, for example, on oxygen that several other cities faced, or has the city prepared itself?
Hi, Shivani. Thanks for asking me. See, a couple of things, as the health secretary was mentioning, there are 2 things that we have to address. A, the public awareness and also demoting or calming the public and also continuing to rally a field personnel, be it doctors, nurses, other health personnel, everybody. So we need to keep a rolling amount of expertise and help, and also have center units. So I think the government has that idea very well in place. We have so far I think one of the strong points to my knowledge and to my observation.
Okay. Ma'am, we don't have a very good link with you. You were about to mention one of the strong points. I'll try and come back to you. Let me go across to Dr. Anusha Rohit also. Your thoughts on what needs to be done immediately, because we are continuously facing this onslaught. Today is the second, third wave in a city like Chennai, for example. Tomorrow a fourth wave is inevitable, many feel.
Thank you, Shivani, for having me here. And I endorse the views of the other panelists on the show today. What we need to understand is that we cannot get into a comfort zone, or we cannot lose our guard when the number of cases comes down, because a mild infection that remains in the society does get amplified with travel, with loss of restrictions, etc. So now, if you look at what we are doing, we are by the lockdown trying to restrict that, and this effect will be seen when the incubation period of the virus is crossed. So we would probably see the effect of the lockdown probably in about a week or two beyond that. The second thing, as the health secretary told us just now, was that we ramped up testing a big deal. We do not go by rapid antigen tests in Tamil Nadu. We are sticking to the RT-PCRs, which reduce the number of false negatives coming through. So we are doing that. The other important thing that I'd like to bring into focus here is that, when there is a patient who's quarantined at home, even after diagnosis, and the patient feels better within, say, a couple of days, they feel that they cannot transmit the virus, but that's not true. So they need to remain under quarantine and complete the restrictions. See, no longer are the restrictions as it was in the first wave. So each person needs to act responsibly and see that they are not sources of spread of the virus across the community. I think that would be very important. And hospitals, for example, with oxygen supply in Chennai, all of us have literally created oxygen committees within our hospitals, and we are looking at how we can plan for the future. So the surge capacity is looked at, and of course we are coordinating with the government officials for the same. And as from the Madras Medical Mission Hospital, for example, we are trying to continue work with dialysis facilities, with cardiac facilities, along with COVID work, because we also understand that, at this point of time, we cannot afford to lose out patients for other problems because they're not able to access help.
But can I ask you very quickly, Dr. Rohit, are people finding it very difficult to get beds in Chennai, for example? Has it reached that stage? Very quickly.
To be honest, yes, it has reached, but we are all, I think there are quite a few organizations which are helping out. The, city site that is upgraded on a very regular basis has, is giving information, and there are a lot of NGOs working on ground.
Okay.
It has not been the situation as we are seeing in Delhi or the other states, or Maharashtra for that matter. We are not yet there. But we don't want to get there.
You don't want to get there, obviously. Dr. Rama, can I come back to you? You wanted to complete your point about what is working. Ma'am, could you unmute yourself? We are not getting your audio.
Thank you. I think one of the key factors that I would like to state, and it's an observation based on patients who travel from other states and come in to our hospital. I work in a quaternary tertiary care center, like the other doctors as well, is the judicious use of resources that we have, and not give in to the panic and not be overzealous in the use of the resources, because resources are precious, and given that we cannot estimate, or we are still predicting or speculating the level of the surge and the actual volume of what we might be dealing with, using the medications only when absolutely required, having task forces within the units, working with the government to procure resources, and it is every healthcare personal's duty to use it, be it remdesivir, be it even steroid, which is cheap, be it the inhalers, and of course oxygen, and the bed itself. Also promoting the health literacy in terms of when does a person have to come in, providing the amount of comfort to the patient that you're not alone in this. We have systems in place in the state,
and
where
especially
we can check on you.
The kits and all that are being given for those in home isolation, somebody calling them and checking them, that goes a very long way. I have final 1 minute left. I'll just go across to Dr. Vishal once again. Do you believe the situation in Bengaluru, doctor, will get better from here? In other words, have we seen the worst in Bengaluru?
See, much before we got to the worst, I think the government took a firm step to clamp down and create a lockdown here. But we need to remember that lockdown is government's highest way of enforcing behavioral change into citizens, and this is going to be something that is going to be driven by citizens, and lockdown is not the solution. At this juncture, we cannot put this entire onus on the government to say that we will get infected and the government has to create beds. But on the hindsight, I think the thing is that the moment we open up again, it's again going to explode in a similar fashion, because as of now, we know that there are more than 8,000 variants that have been seen of this virus in India. So I think this is really concerning for us, and I personally believe that vaccine is the only answer. And I brought it up earlier also that there are 22 vaccines that are ready for the market today across the world. And I think our focus in India only has to be working on these 22 vaccine companies and trying to bring them and open up vaccination for this country.
Right, absolutely. No, absolutely. On that front, the work is ongoing. And on the other front, of course, the governments are preparing their own facilities and getting themselves ready as to what needs to be done right now. Even as the vaccination, of course, and as the Tamil Nadu Health Secretary was saying, that's a midterm thing. What you take a jab today, you are protected for the next few months. It doesn't solve the current problem as it stands. And that is solved by your testing, tracking, containment, and of course, continuing to instill COVID behavior. We hope that the situation, of course, gets better in both Chennai and Bengaluru. Lessons have been learned nationally from what has gone on well and not. So far, there hasn't been as many SOSs coming in from these cities as was the case, for example, in Delhi, and we hope it continues like that. A big thanks to all of our guests for joining us. Thanks a lot for watching. Time for a very short break.